1. Early warning signs of hip pain you must never ignore. Safeguard your mobility. The hip joint, a ball-and-socket marvel, plays a pivotal role in our mobility. However, this crucial joint is susceptible to wear and tear, leading to pain and impacting our daily lives. The good news is that recognizing the early warning signs of hip pain allows for early intervention and potential treatment options to prevent further complications. This article explores 11 key signs your hip might be sending out an SOS, along with tips for maintaining hip health and when to consult a doctor for proper diagnosis and treatment. 1. Gradual onset of hip pain. Hip pain often develops gradually, worsening over time. You might experience a dull ache or stiffness in your groin, buttock, or thigh area, particularly after prolonged sitting, standing, or walking. This pain might ease with rest, but return with activity. 2. Pain affecting daily activities. If your hip pain becomes so severe that it starts interfering with your daily activities, such as climbing stairs, getting dressed, or walking, it's a cause for concern. Pay attention to how the pain limits your mobility and seek professional evaluation. 3. Pain worsened by specific movements. Certain movements can exacerbate hip pain. This could include activities like squatting, bending down, twisting your hip, or lying on the affected side. Identifying movements that trigger or worsen the pain can provide valuable clues for diagnosis. 4. Limited range of motion. Hip pain can restrict your ability to move your hip joint through its full range of motion. This might manifest as difficulty raising your leg high enough to put on your shoes, reduced flexibility when bending down, or a limited ability to swing your leg outwards. 5. Clicking or popping sounds in the hip. While occasional clicking or popping sounds are not necessarily alarming, they can sometimes indicate underlying issues. If these sounds are accompanied by pain or a feeling of catching or grinding in your hip, it's crucial to consult a doctor to rule out any serious problems. 6. Hip pain radiating down the leg. Hip pain can sometimes radiate down the front or back of your leg, extending to the knee or even the foot. This radiating pain can be a sign of nerve irritation or referred pain originating from the hip joint. 7. Weakness or instability in the hip. Hip pain can be accompanied by a feeling of weakness or instability in the affected hip. This can make you feel unsteady on your feet or increase the risk of falls. These symptoms could indicate muscle weakness or damage to the hip joint itself. 8. Morning stiffness. Morning stiffness in the hip that improves with movement can be a sign of arthritis or other joint conditions. The stiffness typically lasts for 30 minutes or less, but can be a source of discomfort and limit your mobility upon waking. 9. Difficulty sleeping due to hip pain. Hip pain can disrupt your sleep, making it difficult to find a comfortable position. The constant ache or discomfort can lead to sleep deprivation and further aggravate the pain. 10. Fever or redness around the hip. While uncommon, hip pain accompanied by fever, redness, swelling, or warmth around the hip joint could indicate a serious infection. Seek immediate medical attention if you experience these symptoms alongside hip pain. 11. Unexplained weight loss. In rare cases, unexplained weight loss can be associated with certain types of hip pain, particularly in older adults. If you experience hip pain along with unintended weight loss, consult a doctor to rule out any underlying medical conditions. Remember, early diagnosis and intervention are crucial for managing hip pain effectively. If you experience any of these warning signs, it's important to consult a doctor or healthcare professional. They will likely conduct a physical examination, ask about your medical history, and might order imaging tests like X-rays or MRIs to diagnose the cause of your hip pain. Based on the diagnosis, they can recommend various treatment options, which might include medication, physical therapy, injections, or even surgery in severe cases.